A good therapist has to be able to read the client and know exactly what they need at any given time. Just because you're very well versed or very successful in a particular theory of counseling or even a certain technique that you've mastered, that doesn't mean that that's going to be applicable in every situation. So to be an effective therapist and to have maximum impact, you need to be able to read your client and know exactly what they need in that moment, because it can change, of course, between types of clients, but even with the same client over time. There's no cookie cutter approach to working with clients. There's no one size fits all. You need to have a very deep treatment toolbox, so to speak. So things that you can pull out, whether it's psychodynamic, whether it's existential, whether it's cognitive behavioral, whatever the client needs in that moment, you need to be able to read them in that moment, and it may even change throughout the course of the session, and know the appropriate technique to use at that given time. The way that you're able to differentiate between those, as Scotty says, to choose the right tool for the right job, is to identify 3 variables. And so the first, and not only identify, but just differentiate between where you're at in the moment. So the first variable is to differentiate the client types. Obviously, no two people are alike, but clients often fall into certain types and categories, so know that type. The second thing is the client's mood. Where are they at, in the moment or even session to session? And then the third thing is the most pressing diagnostic presentation. So what I mean by that is a client may have multiple diagnoses. Maybe they're anxious and they're depressed. And so last session you worked on depression. That was a big issue. They come in to the next session. You think, okay, we're going to be working on depression today. Maybe not. Maybe anxiety is higher, and that's the most pressing need. So know, what it is that you need to focus on in the moment. And that's what we're going to talk about today. So the first thing is differentiating between client types. By client types, I mean their presentation, how they come into the session, how they act, how they respond. For example, one type might be someone who is very reserved. So that could be a personality trait, or it could just be the way that they're acting in the moment based on what's going on in their lives. It could be that they're introverted, they're a natural introvert. So these clients that are reserved, sometimes, and again, there's a tremendous amount of overlap, so I'm being super general here in explaining these things. But if someone comes in and they're reserved, maybe it's an anxiety disorder that you're dealing with. So they're very anxious, they're very nervous, they're very cautious about everything. Or it could be a substance use disorder, in which case they are dealing with some shame, maybe dealing with some fear. They've been maybe forced to meet with you, and so they're naturally got their defenses up and their guard up. So when you're dealing with a reserved or an introverted client, particularly if they're introspective, give them things to chew on. Give them things to think about. Don't bazooka blast them with information, but when you're able to identify a particular point in their life that's something that really stands out that they need to work on, or maybe is a key cause of some of the issues that they're dealing with, you want to be able to pitch that to them in a way that they can chew on that themselves. That's going to help them to be able to engage and connect with you more, rather than being so guarded and reserved. One of the things too that you want to do is to direct the conversation. If the client is not talkative, if they're just kind of being quiet and staring at you, then you need to take the lead, steer it, because they may not know what to talk about or what the next step is. So show them that next step. Another client type would be, someone who is very talkative, very extroverted. In the case of this, and this could be someone with, say, histrionic personality disorder. Someone with that particular disorder is typically attention seeking, and so they'll do things to try to get attention, to draw attention to themselves, and so that's okay. Let them do that and meet them right there. Or it could be someone who has bipolar and they're in a manic episode, and so they're thoughts are running 1,000 miles a minute, and they are all over the place, bouncing from topic to topic, and they're excited and they're talkative, and it's kind of this word vomit. Okay, meet them right there. But what you want to do in addition to that is focus on a social connection. As you meet them there, show empathy, show concern, show interest with what they're talking about, and then guide that interest to something productive. So match your tone to their tone. That way they're going to feel heard, and they're going to connect more, and you're going to get farther that way. Another type is maybe a passive person, or someone who is disengaged or who is avoidant. This could be clients that are dealing with depression or trauma. So they have a lot of emotional pressure on them, and it's difficult for them to reach out. Maybe it was even difficult for them to come into the office for the counseling session. So again, meet them right there where they're at with that, and develop a buy-in, develop engagement. Show them that you understand what they're going through and that you have some solutions that you can help them. So they're going to be more willing to reach out and explore those things and deal with some of that pain. You want to help them to see the benefits of change and give concrete ways that they can make that change. Because let's be honest, I mean, making those changes, facing that pain is very difficult. So acknowledge that, recognize that, and then show them the way out. Another type is being, clients that are maybe directive. They're very, here's what I want it right now, let's do this. Or they could even be overbearing. You might be dealing with a narcissistic client or an antisocial client who's very manipulative and very savvy, and they're trying to control you and control the session and control the situation. In that case, if they're just avoidant, they're just reserved, be respectful. It's okay to take a passive role. Let the narcissist be the narcissist. Try to understand where they're coming from, why they feel the way they do, and then tactfully insert suggestions or education so that, it's kind of like make it their idea. And then they can go, okay, yeah, I did have a good idea. I think I'm going to change this. If it's an antisocial person, this seems counterintuitive, but it's true. You want to, as appropriate, directly confront that behavior. Call them out. In a lot of cases, doing so will engender a greater respect for you, because they're like, oh, they're not buying my BS. They see what I'm really doing here, and that's going to build the relationship. So you just have to kind of feel out your client, know where they're at. The next thing you want to differentiate is the client's mood. Some clients come in, and during the session, really all they need is to vent. And they just want to share what's on their heart and everything that's going on. And if you are jumping in the middle of that, well, you need to do this, and you need to do that, and then fix this problem, and then let's change this, all you're doing is going to frustrate them, because they want to talk, they want to share. So let them vent, listen, rather than being directive, or you're just going to shut them down. Another one is a client who is overwhelmed or in pain. In this case, the most important thing you can do is to listen. Meet them in their pain, show appreciation for what they're going through. Take the time to understand and to feel what they feel. You want to give encouragement and support to them. And then one of the things that you can do also is to highlight the strengths, what they're good at and what has worked in the past. Okay, you're dealing with this now. How did you overcome this previously? Show them that, and that's going to help them to move forward in that direction. Another client that you might encounter is one that's extremely optimistic, extremely overconfident. Again, this could be, a manic episode. So in those cases, if they're thinking, well, I'm going to quit my job and apply to this hot job they're maybe nowhere near qualified for, and they expect to have it by tomorrow, you want to ground them back in reality and say, okay, maybe that's a good idea. Let's look at all the pros and cons of this. So bringing them back to reality and kind of reining in that sense of grandiosity or over optimism. Some clients are just kind of clueless. They know that they have an issue. They know that there's a problem. But they have no idea how to solve that problem. And maybe they're even struggling with how to articulate, what's going on with this problem. So in that case, you want to give them guidance. You want to give them insight. So develop that insight so they can kind of see what's happening in their life. Help them understand what's going on. And you might even use Socratic dialogue. And that's a technique where you ask questions. So rather than just directly telling a client something, you are unsuccessful in business because you're not proactive. You don't do the things that you need to do, and that's why you're at the bottom rung on your job. Maybe saying, well, how do you think you're passing up all these opportunities and not reaching out to help others and not going the extra mile to show that you're a part of the team? How do you think that's affecting your job performance? And so then they come to the conclusion on their own, and it's not defensive. You don't have to force an opinion. They arrive at that opinion themselves, and you just kind of show them the way. Now, throughout the course of a session, mood can change, so bear that in mind. So any of these types or any of these moods that I've been talking about, that can shift moment to moment. So be able to pivot your approach. depending on whether you need to encourage or whether you need to challenge or whatever that might be. The last thing is to differentiate the most pressing diagnostic presentation. That's a mouthful. So what is the most important thing that I need to deal with right now? And then link that with key treatment components. So what's going to work the best? Again, going back to the analogy, you may be great at hammering, but if it's a screw that you're dealing with, that's not going to work. It's just going to do damage. So be sure to match your technique to what's going on with the client in that moment. Some clients are not great historians, and what I mean by that is when they recall the events of their life or even the events of their day, it's distorted. They're not seeing things very clearly. Some have distorted ability to share what's going on in their life because of cognitive deficits. So there might be some developmental delay, or there might be some borderline intellectual functioning. Could be psychosis. Maybe they're having a hard time telling really what's going on in their life because of all this distorted stimuli they're experiencing. So in those cases, be sure to reality test. So reinforce what's happening, share the facts with them, and reality testing will help them to see what's true from what's false, so they know what is within the realm of their control and what they actually do need to change. For those, behavioral therapy is usually best, and it works really well with children as well, because it's very grounded in simple, basic steps that they can take right away. So the next one is a client who is engaged, so they're very involved in the therapy session, and they're highly motivated. So this is a great place to be. Sometimes when clients come in and they have this approach to try to start back and go slow and develop insight and all these things that you might with another client would derail a client that's already raring to go. So in those cases, you want to just jump right into a solution-focused approach. So brief therapy. You want to outline the problem. Here's what's going on. Construct action steps, and then just let them loose so they can attack that problem and solve it. Then all you have to do in subsequent sessions is troubleshoot. If it didn't work, how do we go back? How do we fix it? How do we adjust it? Another client type would be hurting. So if the diagnostic issue is something like depression or complicated grief, those kind of things, what you want to focus on is supportive therapy. So you're going to take a very client-centered approach. In this case, you're going to create the greenhouse. You're going to show empathy. You're going to show compassion. You're going to show unconditional positive regard. No matter what they're going through, meet them right there, accept that, validate their feelings, and then redirect them to better options. One of the things that will happen if a client is in crisis is this significant reduction of options, to the point it can get so severe that they feel hopeless and the only option is suicide. In that case, what you want to do is expand their options, show them that there are other things that they can do, and move them from a place of wanting to kill themselves to a place of wanting to reduce or eliminate the emotional pain. And so we're creating a pathway, creating new options, and that's going to create new hope and optimism for moving forward. Some clients are resistant. So again, case in point, substance abuse clients. Maybe someone has been court ordered. They have to be there with you. They've been forced into treatment. This is the better alternative than jail. And so they're not really there because they want to change. They're there because they have to be. And they might be resistant to what you're trying to share, or they might be in denial. I mean, it could be denial regarding substance abuse, or it could be denial over any number of things. Maybe their spouse is cheating on them and they're in denial about that, or their life is crumbling around them and they're thinking, no, everything's fine. So you need to point out to them the reality of their situation, help them to see things clearly, and then highlight those possible consequences for inaction, for failing to take the steps that they need to take. If you don't follow through with this, well, then this is what could happen, which is why we need to take some steps to minimize that negative outcome. What can we change? Recognize that helping someone overcome their denial means helping them essentially face their pain. And doing that is, well, for lack of a better word, is painful. To acknowledge that I'm being cheated on, to acknowledge that my child is strung out on drugs, to acknowledge that I'm strung out on drugs, to acknowledge that this job that I'm at, I'm getting ready to get fired, or it's getting ready to fold, and it's really going to be economic hard times. Facing that is difficult, and denial is a way to defend against that. So to get them to overcome the denial, they have to face the pain, which means there's going to be a significant part of support that you have to require to incorporate into that as well, so they're able to face that. So along those lines, roll with resistance. If you've got, like a substance abuse client that's not wanting to make changes and they just don't want to be there, you can approach it like, okay, I get that you don't want to be here, that you're forced to be here, but since you have to be here, might as well get something out of it. And so again, connecting with that buy-in, rolling with resistance, accepting it, and moving forward. Another client that you might encounter is someone who is growing, and so this is what we would call the maintenance stage. They're doing really well, and at this point, clients can check out even though all the work's not done. They might be thinking, well, I'm fine, I'm done with this. When in reality, maybe not. Maybe there's some things that we still need to work on, but they've just seen significant improvement. So we want to stack on success, build on the successes. So practically and consistently apply what they've learned, help them to do that, help them to identify new goals, help them to develop new skills to reach those goals. So that's the kind of the maintenance, the growth stage. And then lastly, some clients come in and they're lost. In this case, you want to use psychoeducation to help define the problem. They're not certain exactly what to do or why they are in the situation that they're in. So you can use psychodynamic techniques to help them to build that insight into what's going on in their heart and in their mind, and then use cognitive behavioral therapy to bring about changes in their thinking and in their feeling and in their behavior. So the long and the short of it is, clients are very different, and just because you are exceptionally well at one technique, it is in your best interest to get at least proficient in the other techniques, so that as you're in session and as clients change or different clients come in and out of your office, you're able to adjust and have that right tool for the right job, and be able to do it right there in the moment, because once the moment's gone, then it's over. And you just have a brief window in time to make a positive impact in the lives of your clients. So make sure that toolbox is deep and that you know when and how to use each of the tools. Until next time, don't just be transformed, be kinged.